So a typical craniosacral session would include checking all the base plates around the skull, making sure that they're in alignment. I would check the neck. A lot of times with brain injury or concussion, they've either suffered whiplash or some type of cervical or muscular problems. So I usually start with just kind of relaxing the muscles around the shoulders. At the same time, I can palpate and see if there's any areas that I need to specifically address. In the upper traps, and then the posterior cervical muscles. Before I start the session, I would have checked on their range of motion, if they were having any symptoms like headaches or dizziness or nauseousness. So then I would manual traction and position my hands beneath their head. And at this time what I'm doing is trying to determine if the cerebral spinal fluid is flowing. What I check for is symmetry, quality, amplitude, and rhythm. I also can determine if there's any type of restrictions. And what I would do is induce a still point at this point if I see that there's restrictions or any of those four things are not what they should be. And to induce a still point, I just stop the flow of the cerebral spinal fluid and allow it to reset. And that can take anywhere from just a couple minutes to even a half hour, depending on how many restrictions or issues the patient's having. The next thing I would do is put my thumbs on each side of the temples here, and this is to decompress. And then check the rhythm of the sphenoid bone, which is on each side here. It should be rhythmically moving up and down. Do a parietal lift. This is all done with very gentle pressure, not much more than the weight of a nickel, about 5 grams. A frontal lift. And at this time, you're just making subtle movements to try and reposition the 7 plates that are in the skull if they happen to be out of a line. And then what I like to do is I like to finish with doing some gentle massage around the forehead, trying to pull and stretch those muscles because they don't normally get worked on. I work around their sinuses, at the temporalis, again around their sinuses. And then I always check the jaw and the masseter muscles because a lot of times those can be really tense and tight after after a head injury. And again, the temporalis. And then another part of craniosacral is the ear pull. That again allows for some decompression, alleviates pressure. And then I just finish up with some more gentle massage, making sure that they're relaxed and their muscles are all okay around the upper traps and the scalings. And the last thing with craniosacral I would do is a suboccipital release, which basically just releases that sphenoid occipital joint there so that it's open and the cerebral spinal fluid can flow like it should. And that's just kind of a quick what I would do in a typical craniosacral session with my patients.